This is QD Clinic. I am Jack Cush with RheumNow. QD Clinic is brought to you by RheumNow.live. Today's case is a patient with a problematic past history. Oh my goodness. So a 62-year-old white female is referred to you by the cardiologist because she's got, a long history of rheumatic things. She was diagnosed with ankylosing spondylitis, and she has occasional pains in addition to her hypertension and cardiac concerns, which are not all that major. She's 62, and 20 years ago, she was diagnosed by a local rheumatologist as having ankylosing spondylitis because she had chronic low back pain and was recently diagnosed with uveitis that required steroid treatment. The rheumatologist managed her low back pain by doing x-rays and by doing lab tests. I don't have the lab test. I assume a B27 maybe. Who knows? So, and she's carried this around, but he's mainly managed her. Sorry, I'm having some technical difficulties here. Mainly managed her with nonsteroidals over this many years. And the question is, when she comes to see you because of her ankylosing spondylitis and she wants some kind of management. What are you going to do about it? Well, she has no back pain today. Her morning stiffness is 5 to 10 minutes when she does have it. It's kind of general. Hands and feet. And on exam, she has what looks to be a pretty mobile cervical and lumbar spine. I don't have any x-rays. I don't have any labs. But she's worried about her ankylosing spondylitis because she has multiple medical problems. And the question is, what are you going to do about this? I'm going to manage what she has. She has some stiffness. She has some poor sleep. Her exam shows no tender joints, no swollen joints. She has evidence of Heberden's nodes and says that those sometimes bother her. So I think that this happens all the time to us, does it not? Someone comes in with a past diagnosis that handcuffs you, and you're going to have to deal with it in the context of their current complaints. Luckily, this patient doesn't have current complaints. And what I do is I like to talk about you back then and what your diagnosis was with your old rheumatologist. And, I don't have great documentation. I certainly respect what you say, but we're going to move forward with you right now. And the new you is not the old you, right? So the old you is not your past diagnosis. The new you is not your past diagnosis. The new you is not your family history. The new you is not what your best friend tells you should be worried about. We're going to deal with what you have today. And that's the case you make. So in this case, she's got some stiffness, some Heberden's nodes. We suggest that she takes PRN analgesics with either Tylenol or over-the-counter Advil. And we give her guidance on how to better manage her sleep, because if she sleeps bad, she's going to feel bad. If she sleeps great, she's going to feel great. So her problem is not what she had 20 years ago. Her problem is what she has now. And we want to maximize her condition now and look forward to how she's going to be in the years to come with preventative measures and good advice. Keep following the patient, keep encouraging the patient, keep reassuring the patient that her past diagnosis is no longer in play. This happens all the time with people previously diagnosed with spondylitis, previously diagnosed with fibromyalgia, previously diagnosed with lupus, previously diagnosed with seronegative RA. But again, you have to deal with what they have today. That's my advice on managing this kind of case. I want to recommend that you attend RheumNow Live. Our second day, which is Sunday, February the 9th, begins with a lecture by Desiree Vanderhyde on the management of spondyloarthritis. Oh my goodness, really? In that same session, we have Catherine Bakewell talking about imaging in spondyloarthritis. And well-known dermatologist Jennifer Cather talking about hidradenitis suppurativa and its management. And then we're going to have a great panel discussion. Be there online or in person in Dallas. We'll see you February 8th and 9th, RheumNow Live.